Seen as a preventative tool for cardiovascular disease. But in the past 5 years, recommendations on low-dose aspirin have changed. A new study suggests certain seniors still taking a daily aspirin could be putting themselves at risk. Today, Jeremiah Jacobson explains the potential dangers of taking aspirin every day without medical advice.
It's a decades-long belief that seems to be taking some time to debunk. Historically, aspirin has been seen as a tool to help prevent heart disease.
What happened a few years ago was that clinical trial data revealed that in older adults, the benefits of aspirin may not outweigh the risks of aspirin.
In 2019, the American College of Cardiology and the American Heart Association updated their guidelines to say that aspirin should be used infrequently to prevent a first heart attack or stroke for those with no history of cardiovascular disease.
Aspirin is a blood thinner, so it affects platelet function, so it affects clotting and increases the risk of bleeding.
Dr. Ashish Shiraji with Cleveland Clinic is one of the authors of a new study looking at daily aspirin use across the U.S. since the recommendation changed. They found that in 2021, about 1 in 3 patients 60 and older who did not have a history of heart disease were still taking aspirin every day for prevention. Based on that data, they project about 3 million of those people across the U.S. were taking it without medical advice.
If you have heart disease, oftentimes aspirin is required, and stopping aspirin without the doctor's advice is dangerous. But if you're taking aspirin in the absence of heart disease, it's something that no one's advised you to do, and you're 60 years or older, it's time to have a discussion. Disclose that to your doctor.
Health experts say since aspirin's over-the-counter medication, many people don't even think to tell their doctor they're taking it. But they say it is very important to disclose that. We're back with your good news after the break.